Hi, this is Dr. Byrne. I'm the owner here at Cognitive Psychiatry of Chapel Hill, and I am looking forward to telling you more about some of the exciting changes we have here at the practice in 2019. So I had sent an email a little while earlier as a sneak peek of what's to come, and we're going to have 3 videos this month which talk about our 3 new areas of focus. So our first area of focus is on outcomes. And I'm going to tell you a little bit today about how that will work. In our other videos, we'll tell you a little bit more about care management and wellness, so be sure to keep an eye on your emails going forward. So let's talk today a little bit about outcomes. The way that we are going to track outcomes at CPCH is to use validated tracking tools. We have a lot of different tools we can use. Some examples are CBS Health, which is Cambridge Brain Sciences Health, computerized cognitive testing tool. This is something that can be done online at home, normally takes about 15 to 20 minutes. We can use the PHQ-9 for depression, the GAD-7 for anxiety, and Vanderbilt for ADHD. These are just a couple of the tracking tools that we will use. So let's go through maybe 2 examples and see how tracking tools and outcomes will help to get you feeling better faster and staying better in 2019. So let's talk a little bit about ADHD. Many of our patients here at the practice have a diagnosis of ADHD, which affects different parts of their cognition, especially attention and focus. So a lot of our patients ask us, how do I know if my medications are working optimally? I feel better, I think they're working, but how do I really know if this is the optimal dose for me? So using our computerized cognitive testing, we can reach out to you and have you do a baseline test. This would be a test that you do off medication to see kind of what your baseline attention and focus looks like. Then we'd have you take your medication and in a couple hours retake the test. This will let us see how your cognition, in particular attention and focus, is doing when you're taking the medication. And we can see using this test, because it compares you to others in the same age and gender, to see whether you're really getting optimal results. Let's say that your doctor, that you want to try to switch medications or take a new dose. We can do the cognitive testing a 3rd time and then compare it to the other medication to see which is really working the best for you. So that's an example around ADHD. Let's talk a little bit about depression. Depression is another very common problem that we help patients with here at CPCH. So using the PHQ-9 as a validated tracking tool helps us put a number on what you're experiencing with your depression. And you might say, well, why is a number helpful? Isn't it more important how I feel? And yes, it is very important how you feel. But having a number can sometimes give us more information that can help us tailor your treatment even better. So let's say you have depression. And you're coming into the practice and you want to get help. We can use the PHQ-9 to get a baseline score of your depression and then reach out to you every couple weeks to recheck your PHQ-9 and see if you're making improvement. And we'll talk a little bit more in another video about how our care manager is going to help with this. But for now, just realize that we'll be rechecking the PHQ-9 to see how you're doing. If you're not getting better or you're not getting better fast enough, we can talk with the doctor and think about ways we might need to tweak the treatment plan even between your doctor appointments. This again will help you to feel better faster. So these are 2 examples of how we'll use validated tracking tools to help you in 2019. But what about if you're feeling great? So a lot of our patients have been working with us for a long time and they're feeling great. And that is obviously what we're going for. How do the tracking tools help those of you who are feeling great? Well, there's 2 important ways. The first way is that we want you to continue to feel great. Unfortunately, a lot of mental health issues can be relapsing, meaning that they can come back over time. So by tracking how you're doing, even when you're feeling great, we can sometimes pick up little deviations or little trends or signs that things might be going awry. And we can work on it quickly so that you don't go back into an episode of, let's say, depression. We catch it early so that you continue to feel better. Another way that we help patients who are feeling great is sometimes patients want to decrease or even come off of their psychiatric medications. And this can be very appropriate. Obviously, you'll talk with your doctor about this. But let's say that you do want to try to come off your medicine or decrease the dose. Using the validated tracking tools can help see that you're doing okay even as you're coming down or off the medication. Again, we can catch things before they become serious problems, and we can tweak your treatment plan to make sure that you continue to feel good and that we don't put you at some sort of risk of relapse. So I hope this information has been helpful. I'm very excited about using these tracking tools to get you feeling better faster and to keep you feeling better. If you are curious and you'd like to see a sneak peek of the CBS cognitive assessment that I mentioned earlier, I have a link below that you can click and do a demo program and see exactly what I'm talking about. So keep your eyes open for our next video, and I look forward to working with all of you in 2019. Thank you.